Evening, folks. I have discussion C for you for the night. Now we're going to discuss care and support needs of older adults living at home with chronic conditions in the United Kingdom. And the World Organization's international classification of functioning disability and health. Okay, so here we go. This study is a scoping review that systematically maps the evidence on the care and support needs of older adults living at home with chronic conditions in the United Kingdom. What makes it distinctive is the use of the World Health Organization's international classification of functioning disability and health, or ICF, framework, which provides a structured way to categorize needs across physical, psychological, and social and environmental domains. By applying the ICF lens, the authors move beyond purely medical view of aging to capture the lived realities of older people. Why the study was done. The backdrop is demographic change. More people are living longer, often with multiple chronic conditions, while health and social care systems struggle to keep peace. Informal caregivers, family, friends, neighbors are increasingly stretched, and formal services often fail to care or fail to coordinate effectively. The authors argue that without a clear evidence-based understanding of what older adults themselves identify as their needs, policy and practice risk being misaligned. This review therefore seeks to map the terrain of need. So that future interventions can be designed with precision and empathy. How the review was carried out. Scope and sources. The team searched 5 electronic databases, supplemented by Gray lecture and reference lists, covering studies published between 2008 and 2018. The focus was on older adults with chronic conditions living at home in the UK. Methodology. Following Arsky and O'Malley's scoping review framework, the authors extracted and coded findings line by line in NVIO software. Themes were then conductively mapped into the ICF domains. Rigorous screening, charting, and linear rater reliability checks were reported, ensuring transparency. Perspective. Importantly, the review privileges the voices of older adults, capturing their subjective experiences rather than relying solely on clinical assessments. Main findings organized by ICF domains. Body functions, physical and mental health. Commonly reported issues included pain, fatigue, breathlessness, sensory impairments, incontinence, and sleep problems. Psychological distress was widespread anxiety, depression, fear of losing independence, and frustration with diagnostic uncertainty. These symptoms were not isolated but interconnected, compounding the burden of daily life. Activities and participation. Self-care tasks such as washing, dressing, and toileting were often difficult. Domestic activities, shopping, cooking, cleaning, posed challenges, especially when mobility was limited. Social participation. Suffered loneliness, reduced leisure engagement, and strained relationships were common. Despite these barriers, many older adults demonstrated resilience, adopting self-management strategies to maintain independence. Environmental factors. Family and informal carers were critical supports, but their availability and reliability varied. Personal care was inconsistent with poor coordination across services, and limited information about care pathways. Transport difficulties, restricted access to services and social life, assistive technologies, and home adaptations offered. Potential but hindered by cost, usability, and design flaws. Implication for practice and research. Service design. Care models must be person-centered, aligning with older adults' express needs. Rather than imposing top-down solutions. Better coordination, community, and accessible information are essential. Psychological needs, emotional and mental health concerns require more systematic detection and support, not just physical interventions. Research gaps. The authors highlight the need for studies on older workers, older carers, and effective self-management. Strategies for multiple comorbidities. Policy relevance. Findings underscore the importance of integrating health, social care systems, and investing in caregiver support and designing environments that enable participation. Limitations and final takeaway. Because the review synthesis diverse study designs and includes gray lectures, the quality of evidence varies. The findings provide a map of common need areas rather than a detailed catalog of individual circumstances. Still, the overreaching message is clear. Older adults living at home with chronic conditions face interwoven physical, psychological, and social challenges, and current services often fail to meet these needs. The paper concludes with a call to action: redesign support systems around older people's priorities, recognizing their resilience and self-management strategies while addressing gaps in coordination, emotional care, and environmental supports. In essence, it reframes aging as not a passive decline, but a dynamic process requiring responsive, holistic, and inclusive care. Okay, guys, that's C for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness, take care, folks.